Hey, I'm Marsha North. I'm one of the care managers here at LifeCare Solutions. So signs and symptoms of a stroke that we need to be aware of, there's a quick acronym that we can use. It's called BFAST. What does BFAST stand for? The B would be any sudden change in balance. If you noticed your loved one seems to be walking, leaning more toward the left when they're walking, you want to be concerned about that. If they report a sudden change in vision, either in both eyes or even one eye, and there's no pain involved, that can be a sign of a stroke. Classic sign that you're probably more accustomed to hearing about is facial droop. If you notice that your loved one's eyelid is sagging, or maybe their lips aren't symmetrical, that would be concerning. And a quick assessment you can do is have them smile or ask them to lift their eyebrows. Moving along, another sign or symptom of a stroke, weakness in their extremities. Usually we'll see it in the upper arm. So what you get a quick assessment of that, if you notice, they're complaining that their arm's numb, tingling, or heavy, one way you can assess that is have them to lift both arms. And if you see that one is falling behind, that's a concerning sign. So now we're down to our S in the BFAST, and speech is also changes in that we'll see with this patient with a stroke. Either their speech is slurred or it's garbled, it just isn't making sense. Say you ask them a common question, is the sky blue? And perhaps their answer is gobbledygook. That would be concerning because that would be signifying a change in the communication centers of the brain. So any changes in speech, whether it be slurred, inappropriate answers, those are concerning. So all of those things lead us up to making the T in BFAST. We want to telephone 911 ASAP anytime you see any of these changes. So let's review that. Change in balance, sudden change in vision, sudden change in their facial appearance, any sudden changes in their arm body movements, especially if you see it's leaning toward one side, and then changes in speech. So any of those, let's call 911 so we can get to the hospital promptly.